Hi everyone, my name is Donna Trujillo. I am the payroll manager here at Grand River. Welcome, and I hope you find this very informative today. Right now we have, she asked me to introduce her as Marissa the Fantastic Kennelly, and I am doing that because I think it's true.
Thank you.
She is going to talk about billing. She's going to go over some of the things about billing that may help you. If you have any questions, you are more than welcome to call PFS, and they will be more than welcome to help you. So please welcome Marissa Kennelly.
Hi, thank you. I'm happy to be here to talk all things patient financial services, or PFS, with you. Today I'd like to go over the medical billing cycle and kind of a step-by-step process on what you can expect for timelines and kind of how that all goes from the time you check in with registration for your appointment all the way until your final bill is paid. So we're going to dive in here. I also have copies of these brochures that I can make available for anybody who would like one. But the medical billing cycle is a pretty complex system. It consists of essentially 10 steps. So we'll just go through them a little bit one-on-one here. So the first step in the process is patient registration. That's when you come in and you register, and they make sure we have all your demographics, your insurance information, your address, phone number, and any way that we need to contact you. You also sign very important forms for consent to treat and consent for us to release your information to your insurance companies. It's vital that we get those so that we can release any medical information to your payers to try to get your bills paid. So registration is a big step in making sure that we get all the information needed. The second step is establishing financial responsibility. So that's things where we can get you estimates on what costs are going to be. We can talk to you about setting up payment plans. If there's a copay, we'll ask you to collect that. Things to that nature, just to make sure that you kind of have an idea of where you're going to be financially after you see the provider that day. Number 3 is going to be patient check-in. So that's also where you get checked in and you get your, you'll probably be asked to pay your copay, or sometimes they'll ask you to pay on your deductible, set up a payment plan, that sort of thing. It's similar to step 1. Let's see, step number 4 is patient checkout. This is a time where you get checked out. If there's additional tests and things that need to be run, they can register you to get those done. The great thing about Grand River is we're a rural healthcare and a critical access hospital. So what that means is you can see your primary care provider or your specialist, but then if you need lab work or radiology or anything like that, imaging, we can send you to the hospital site and usually get those done the same day, or at least get them scheduled for a day sooner. Step 5 is going to be claim coding. That's when the doctor's done seeing you, they've dictated everything that you talked about in your visit, in your chart, they've made a diagnosis, and they've identified any procedures that may have had to be done. And then that goes to Grand River's coding team, and they get with all the state regulations and healthcare laws and make sure that all the codes are appropriate for what you had done that day, and make sure that the charges reflect what was reported on. Then once that's done, it comes to billing compliance, or the billing team. And there we get all of your information comes over on a claim form. Grand River bills on 2 different claim forms. We have a UBO4, which is a hospital type claim form, and a CMS 1500, which is a pro fee or professional fee. So that's, I like to tell people, that's doctor time, anesthesiologist time. Things like that will be billed on a separate claim form. So we look at those different types of claim forms, make sure that they're tied to your accounts, because each claim has its own unique claim number that ties you into a claim or an account that will have everything for that date of service or that stay, if you were inpatient or had an overnight surgery or something to that nature. So we make sure all the dates are right, we make sure the coding looks good, any types of modifiers or any modifications that need to be made to your claims, we make sure that all looks good. And then once we kind of give it that stamp, we're kind of what we like to call the cleanup crew. If there was a step missed somewhere, we'll reach back out to providers, we'll reach back out to coding to say, hey, would you mind taking another look at this? I think that this needs to be added or taken away, or I want some clarification on that, because our goal is to get these claims paid on the first try out the door, because that's a more timely payment for us, and then as well getting you guys statements for your things. So we call that scrubbing claims. So after the claim is scrubbed at the billing department, we send it out. Typically from step 1, patient registration to this point is about 7 days. So it's about a week before your bill gets ready to go to your insurance or self-pay to a statement after your doctor visit. Sometimes with higher volume stays, like an inpatient stay or an in-swing, it takes up to 10 days just because there's more charges that need to be reviewed because you were here for a longer amount of time. So, and then let's see, step 7 is insurance processing. So again, scrubbing the claims, we try to send out clean claims so that they get processed timely. Each insurance has a timely filing limit. In the state of Colorado, Medicaid and Medicare is a 1-year claim timely limit. So we have a year from your date of service to submit a bill or a claim to them. Typically, we have the bills out the door within 10 days. And then some of the other insurances, the commercial insurances, a good ballpark number is between 90 to 100 days is how long we have to submit a claim. The hospital's policy for self-pay or anything that would process with your insurance and then come to you is a year from the date of service. So we have a year to get your insurance to collect from your insurance and then bill you whatever the insurance deems as patient responsibility. So then that process, if the claim goes out clean and we only get paid once and we bill you, it's probably a good turnaround to say that you should see that bill within 90 days of your date of service. It takes most insurance companies about 45 days to process a claim and get back to us, and then we have to have time to generate a statement and get that out the door to you. If the claim doesn't go out clean or the insurance requests documentation, that could be medical records, accident reports, if they think that your visit was a result of maybe an auto accident or a work comp accident, they might ask for additional information. And if that's the case, then it delays the claim because we would submit that information and then wait for the reprocessing. So there's multiple reasons why that process could be delayed. If you have questions or you feel like it's been a while and you haven't seen your bill, you're always welcome to call our office and we can go over that and see what's going on, or maybe we need to call at the insurance and follow up on that. So feel free to give our office a question or a call with any questions. The next step is insurance appeals. This is where if an insurance denies and it's something that we feel we can get paid, we'll send in appeals and try to get it paid for you. Sometimes there'll be a situation where we'll call you and ask you to do a 3-way conference with your insurance for us, just because it helps get the insurance to be a little more kind. They tend to be nicer to their members than they do to the payer or to the service providers. So we might ask you for your assistance in that, or if there's a special form that needs to be filled out by you, we'll try to bridge that gap so we can make sure that you get the information you need to be able to fill that out. And then usually after an appeal, we have the option to do a second level appeal should the first appeal not work, but usually after a second level appeal, it's kind of the decision lies where it's at. And then at that point, we can try, but usually, hopefully by that point, your claims have been paid by your insurance. Then the next step is step 9. This is when you should get an explanation of benefits or an EOB from your insurance provider. And that should explain to you a breakdown of how your insurance paid, what went to coinsurance, what went to deductible, what went to copay, how much out of pocket you've met, those sort of things. And then once you get that, it should tell you what you're expected to pay and break that down so you know how much of each you're paying on. So a lot of plans are 80-20 coinsurance, so 20% would be your coverage. And that is of covered charges. So if you get something done and your insurance deems it's not covered per your policy, that is going to be patient responsibility. So just keeping those things in mind, that it's always good to call your insurance and try to get an authorization, things like that, so you know ahead of time that your procedure and what's going to be happening is going to be your responsibility or not. And if you do have that, how much of those covered charges are going to be your responsibility. With that being said, each insurance that we are contracted with and we accept as in-network, we have a contract with that allows, we take a discount from them on your behalf to see you as their patient, or take their insurance and see you as our patient. So most of our insurance plans have a contractual discount, and you might see that represented on your explanation of benefits as well. All right, then the next step is step 10. That's when you get a statement from Grand River. And our statements have changed in the last year and a half or so. So now a lot of people are saying they're not itemized. On the back of the statement, for the most part, they're itemized. But it's a statement number on the front. It has an SN and a couple zeros and then your account number. That'll be everything you owe as a whole. And then if you flip the statement over, it'll be itemized out by date of service for you. And then if you need further itemization, give our office a call. We can get you an itemized bill in very clear detail for that. All right, and then step 11 is going to be where our office tries to set up a payment plan with you or get the bill paid in full. And then if that's not established within 181 days, then you're eligible for our collections. So we have a sister company that's called ARS, or Accounts Receivable Services, and they are out of Grand Junction, and they're a pre-debt company. So when you get a letter from ARS, you're not in collections, you're just at that bridge between collecting at Grand River and collecting at a collection agency. Their job is to be there for 30 days to contact you and say, hey, you owe money to Grand River Hospital, we need to establish some type of a payment plan or get this paid in full, or you'll be eligible for collections, and they should give you a date so you have some ideas of what's going on. And at that time, if you're finding yourself in financial hardship or you want to apply for some financial aid and assistance, we have the Hospital Discounted Care Program, or HDC, that you can apply for through Grand River's Patient Financial Services, and we have the Colorado Indigent Program, which is referred to as CICP, and all of those have a bunch of steps in them, but you can apply for those to help with people with high deductibles or unforeseen major medical events. So we can talk about that if you're interested in looking at some financial reprieve. And then the last step here is just, if you don't pay your bills, you go to collections, and then it gets pretty ugly. It hits your credit. If you don't establish something with credit companies, then you can get into liens and garnishing and all that sort of thing. So we try our best to keep you out of that. So I would much rather have a conversation with you on how we can help you get these things paid off, because I understand medical bills are not always planned. So we'd much rather have those conversations with you, offer you programs that we think you qualify for, than send you to collections. So we do encourage everybody to give us a call if you would rather sit down in person. I'm a supervisor over there. I'm happy to sit down with you in the office and go over your EOBs and your bills and help you understand why you owe and what we can do to help you bridge that gap and get these things taken